access patients and how we deal with them. Our last topic we're going to move on to that we're going to cover rather quickly is around blood sampling from a vascular access device. Dawn, at a very high level, can you just talk to us about the risks versus the benefits of getting a blood sample off of a vascular access device?
Certainly. So when obtaining blood samples from a vascular access device, we know that there is a risk for hemolysis, which delays treatment and it delays diagnosis. So we understand those things. We also understand that samples from PIVCs, or short peripheral intravenous catheters, can also lead to higher hemolysis rates. But some things that we might not appreciate and might not know, that there are times that samples obtained from a VAD really threaten the sample quality and also affect the lab results. So listen to this. It could cause increased prothrombin time, increased potassium, LDH, AST, ALT, phosphorus, and iron, but we could see conversely decreased magnesium, ammonia, troponin, RBCs, hematocrit. So we actually can see what we don't want to see and what doesn't inform us in treating the patient going forward, because we can get some inaccurate results.
So in regards to this, the standards of practice, specifically, Lisa, could you tell us what specifically they say around drawing from a vascular access device? Should we draw? Should we not draw? And then we can also talk about the different types of devices. But just at a general, just what do the standards say, and should we or shouldn't we?
Okay. One of the questions always is about, coagulation levels drawn off of a line. And the standards speak to the fact that the data is actually inconclusive there. And a lot of the previous data does relate to heparinized lines. Now, moving forward, we're generally not using heparin as much in our lines, at least across the U.S. at this point. So we're talking basically saline flushing. So that may be less of an issue, okay? Cyclosporin levels, it actually adheres to the central line, so you can get high, inadvertently high levels. Vancomycin levels, tobramycin levels have shown statistical increases, but not necessarily clinical increases. I think one of the things to really consider when you're drawing any type of drug levels or labs off of a line is if that value is really off base, it doesn't appear accurate, you do need to retest via venipuncture, and that is clearly stated in the standards.
So from a patient perspective and looking to not have to poke the patient again, how are those risks versus benefits weighed to do the best and do what's right for the patient as far as patient satisfaction, but also weighing with the risk of an erroneous lab result? How do you make that decision?
I guess I would throw in that in general, we're certainly doing a lot of lab values off of our lines. Even in home infusion, it's very much routine to draw the labs off of the central lines in particular, because it is a patient satisfier. And a lot of these patients that we're seeing, particularly at home, they do have difficult IV access. They're going to have difficult access for phlebotomy as well. So if we can follow our procedures, do them accurately. If we're talking about drawing off of a peripheral IV, for example, one of the things you really have to pay attention to is like tourniquet time. If that tourniquet's on too long and you're not paying attention to that, you are going to have hemolyzed specimens. So we have to look at the procedures itself. So we want to promote patient satisfaction as well as accurate lab values. The one that I would throw in is for patients on parenteral nutrition, it is suggested that labs should not be drawn off of a central line because of that increased risk for infection. But of course, an individual evaluation of a patient, that may be weighed against very difficult ability to obtain phlebotomy-based lab specimens as well. So you have to really weigh those risks versus benefits in any situation.
Oftentimes in a clinical setting, a patient would have a central line and they would also have a peripheral line or maybe even two peripheral lines. So Barb, in that instance, saying that the labs would be drawn off of a vascular access device, how does the nurse determine if they should draw that blood sample from the central line or from the peripheral line?
It is a very good question.